Ever wonder what a brow lift can do for you? Today, I'll cover everything you need to know about brow lifts, from different techniques to the surgery, recovery, and typical cost. I'm also going to clear up common misconceptions so you know exactly what to expect. And when you think about brow lift, some people immediately kind of get scared and they think they're going to look surprised and their brows are going to be too high. That's how brow lifts were done 20, 25 years ago. I don't even like to use the term brow lift. I like to say brow contour, because if you think about it, all you want to do is stabilize the brow so that it does not drop. And a lot of people will compensate and they hold their brow in a higher position. So what happens is we go to sleep at night and gravity stays awake. And what I mean by that is we relax all the muscles, but everything keeps pulling. And so when you open your eyes, if you have some droopiness of your eyelids or droopiness of your brow, your brain realizes that you can't see it well. And so it's a fight or flight thing. So what your brain does is it stimulates the muscles in your brow to raise them so that you can see better. And not only see better, but it feels better, because everybody knows that feeling as you get older of having heaviness on your eyelid, which is coming from a sagging brow. What we have to do first is make the diagnosis. And we also need to explain and educate that sometimes you need to do both to have a natural look. If you think about a curtain and a curtain rod, that's a good analogy for the brow and the upper lid. If you walk into your living room and your curtain is touching the floor, you could just trim it with scissors and it would be done. But you probably would say, you know, last week that curtain was not touching the floor, and you'd look up at the curtain rod and you'd see one of the hinges loose and you say, aha, and you tighten that up, and then your curtain looks fine. That's the same way with a brow and an upper lid. If you're in your 20s, 30s, maybe even 40s, we can contour your brow sometimes, and you don't need to have a blepharoplasty to your upper lid. Sometimes people will have something that affects one brow. For instance, if you have a facial nerve palsy and you lose the function on one side of your face, a lot of times we have to lift that brow just so people can see, and also we're trying to give them improved symmetry. Let's talk about how to do brows, all the different types. You can do something called a direct brow lift, where you're directly cutting right above the brow. And that's usually done for people with a nerve palsy or something that affects extreme asymmetry. The other thing you can do is you can do what's called a mid-forehead brow lift, where people will take one or two of the natural wrinkles you have in your forehead and make a long incision and take out an ellipse of skin and tighten all that, and it lifts your brows. Obviously that can give you a scar, but a lot of times you can hide it into a line. People don't do that unless somebody's older. The other thing you can do, what I call the old school way of doing it, is a coronal brow lift. What that means is you're making an incision from the top of the ear all the way to the other top of the ear, and you're going underneath the layers. I like to say that the American Indians are the first ones to do this technique. They called it scalping, because that's essentially what you're doing. You're loosening the entire scalp, you're folding it down, and then you're tightening the whole forehead and hair. It gives a very good result, but the problem is it gives the brow results of yesteryear, where people look very, very surprised. And also you cut nerves, so you feel numb, you have funny sensations on your head, and there's all kind of complications going on. We've always looked for, is there a perfect way to do a brow lift? And is there something where we can get around the vascularity, the nerve problems, and make it look natural? And that's where the endoscope comes in. The endoscope is like a straw with a little camera on it, and you can put it in one side in the hair just above the skin, and you can put a tool, a dissecting tool, in your other hand. And if you're ambidextrous and you're pretty good at working instruments and you know the anatomy very well, you can do all the surgery that people used to do by making a huge skin flap from ear to ear. with only about a 2-inch incision on each side. So when I do a brow contour, I make 2 incisions on each side in the temple region. That's all there is, and I part the hair, and you can't even see the incision when it heals. You don't get the nerve changes, you don't get that surprise look. It looks very natural, and the big advantage of that is where you need the brow stability is in the lateral part towards your ear. That's where people get that overhang of their eyelid that we call hooding. So a lot of people will say so-and-so looks tired, or they look like they're falling asleep. And that's all what we call hooding, where the brow has been displaced down and it's affecting the upper eyelid. Now the counterpart is true. If you think about it, we can't go in and improve your eyelid if you have a droopy brow because it's not stable. It's just gonna pull your brow down more than when we started surgery. I've had many patients through the years where I've explained to them that we can't do an upper blepharoplasty only without doing something to the brow. A lot of times those people go to someone else, and unfortunately, 60% of my practice right now is doing what I call rescue surgery. Rescue surgery is a nice way of saying botched surgery. People will go have things done. You can find lots of people that will do an upper blepharoplasty, especially someone that doesn't know the brow anatomy and they don't do a lot of advanced surgical procedures like a dermatologist. Dermatologists are great for skin cancer and maybe an upper blepharoplasty, but they're not going to do work on your brow area, your cheek, and the different bones around your orbit that sometimes are needed. Those are the different things about brow. Let's talk about recovery. Recovery is like a lot of things. The less you do, the less time it's going to take to recover. So it really depends on how much you need. The advantage of the endoscopic approach is it heals very fast. I don't recommend this, but I literally had many years ago a CNN anchor person that if I said her name, y'all would all know her. And it was during the Persian Gulf crisis. And she got off for 4 days. And something happened that was a big alert that she had to go on TV. The same day she had brow surgery that morning. And so she went on the night of her surgical procedure in the morning, looked great and did great. And I wish I could show it, but it's just a remarkable story. Everyone doesn't look that good, but she did, thank God. The other thing to think about is what kind of investment are you making? Or some people say cost. But I think it's very important to be transparent about what kind of money you're gonna invest. So I put them all on my website, oculusplasticsurgery.com. And that way there's no surprises and we can discuss it. You'll talk to some people and they'll say it starts at this, or the doctor has to see you, and you have no idea. And they're just trying to get you in the office. I want people to know up front what it costs, what's involved, what kind of recovery you have, so there's no surprises. That's why I'm making a video like this to help educate you. Some of you watching this video, I'll never have the chance to meet you, but I still want you to learn about brow lifts and be educated when you go talk to your doctor. So brow lift's a great procedure, and if you ever do it, make sure you're doing the endoscopic approach.